India has just reported nearly 4,000 COVID-19 cases in 2025. Most of them are mild. But is this just a small ripple, or a warning before a new wave? The COVID-19 pandemic changed the world, and while life has slowly returned to normal, we must not forget the most important lessons it taught us. Let's talk about how India can be ready for the next wave, not with fear, but with facts, preparation, and strong public health. As of June 2nd, India has seen 3,961 COVID-19 cases since January this year. There have been 32 deaths so far. Most of these are Omicron subvariants, the same family as earlier variants. The good news? These are not more dangerous or more infectious than previous ones. In fact, 2,188 people have already recovered, which means the virus is not hitting hard, at least for now. Should we panic? No. Should we prepare? Yes. Most states are not seeing big daily increases, but that doesn't mean we should ignore it. High-risk groups like older adults, people with diabetes, high blood pressure, heart or kidney disease are still vulnerable. Precautions for them are simple. Wear a mask in public, wash hands regularly, avoid crowded indoor places when possible. Dr. Soumya Swaminathan, former chief scientist at WHO, says immunity from past infection still helps, but we need booster doses for the vulnerable, and they must be available. The vaccine problem. We need to stockpile vaccines and test kits and distribute them ahead of time, not after a crisis begins. Private and government hospitals must be ready. That means keeping medical oxygen available, having enough beds, hiring and training more doctors and nurses. This isn't just for COVID. This will help us for any future outbreak. The importance of transparency. Another big lesson from the past: never hide the data. We must report cases and deaths clearly and honestly. The public has the right to know, and only with accurate data can we take smart decisions. Both the central and state governments must work with efficiency, openness, and most importantly, trust. Preparedness versus panic. There's a big difference between panic and preparedness. Panic makes us freeze. Panic causes chaos. Panic spreads fear. Preparedness gives us control. It means having a plan. It means being ready, not scared. Our future response must be evidence-based, focused on high-risk groups and supported by strong hospitals and clear communication. Conclusion. The next wave, if it comes, doesn't have to be a disaster. We can manage it, we can protect lives. But only if we learn from the past and act before it's too late. Stay informed, stay safe. And let's make sure India is always one step ahead of the virus. If you found this video helpful, please like, share, and subscribe for more fact-based health updates.